Let's be honest, healthcare headlines these days sound like the script of a medical drama. Waiting lists, workforce challenges, funding pressures. But behind all that, something else is happening. A quiet movement led by people who refuse to settle for good enough. We're at a turning point, a once-in-a-generation moment where science, technology, and sheer human determination are redefining what's possible. In this show, we meet the thinkers, the doers, the dreamers driving that change. The ones turning optimism into opportunity and opportunity into outcomes that really do matter for patients. Because behind every breakthrough lies curiosity, courage, and the quiet persistence that turns ideas into impact. So, grab a coffee and let's find out what it really takes to build the future of health. Welcome, Bruno Botelho. How are you doing?
I'm good, thank you. What an intro, eh?
Yeah, was it good?
It was very good, actually.
Fantastic. Yeah. Well, you're our first guest. Let me do a little introduction of you. So Bruno Botelho is a nurse by background, the Director of Digital Operations and Innovation at Chelsea and Westminster Hospital. He's the brain behind multiple nationally implemented digital solutions, such as AI-enabled discharge summaries, which we'll come on to in a bit, which is helping resident doctors save admin time so they can spend more time with patients. People describe him as a maverick, as a leader, as an innovator. Welcome, Bruno.
Well, thank you. And thank you for that introduction again. You're on fire.
Thank you. How are you feeling today, Bruno?
I'm feeling good. It's been a long day already. But yeah, all good, all good. Thank you for having me and thank you for inviting me to be your first guest.
I appreciate it. Thanks for being on this podcast. And actually, why are you here, Bruno? What is the reason you're here today?
Good question, actually.
Unprepared question.
Unprepared question. I think, look, first and foremost, an opportunity to celebrate some of the work we are doing. Second, to share a little bit of my own experience, my own journey into the digital and innovation role. But more important, how can we probably encourage many other innovators that are out there to come forward and actually leverage some of the work that is taking place up and down the country to improve the delivery of patient care.
Fab. Why don't we understand a little bit about Bruno before we start? So your CV is quite extensive and you've been involved in some of the most innovative projects within the NHS in modern times, but you started off as a nurse and you've kind of worked your way through and now you're a digital and innovation leader. Can you talk about that journey? What kind of brought you here? How did you go from nurse to innovator? Can you talk that through?
Yeah, so you stopped probably at the age of 23. I think before that, I've always had a passion for destroying my toys, coming up with my own solutions. I think my mom would have thought that I would become an electronic engineer, some sort of. But no, I ended up studying wines for 1 year. Believe it or not, there is actually a uni course back in Portugal, if you haven't picked up from the accent, despite my 20 years in the UK. I am from Portugal. Best year of my life studying wines. But I went to nursing because...
I wonder why.
No, the reality was as part of my adolescent journey, I ended up developing probably a passion for caring, and clearly wines was not my thing. And then I became a nurse, but soon realized that probably Portugal was not fulfilling my own objectives and came to the UK. The rest is history, but we can go into a bit more detail into how I've been able to move from being a nurse, a bedside nurse, actually not far from here, at the Homerton University Hospital, working in the A&E department, to then becoming a ward manager, looking to productivity, efficiency, and actually trying to optimize every single step of the patient journey, to then some operational roles that led to the digital space. So it's a journey that in the UK probably goes back 19, 20 years, but one that has been a very exciting one.
What motivates you and what drives you? What are the values that you hold true that keep you going every day?
In the middle of the pandemic, I became a dad. And I'm very grateful, by the way, for all the work done in 2020 by the maternity teams, allowing fathers in certain circumstances to come in and support. But that probably...
You mean during the pandemic when you couldn't have people in the room? And
Yeah, it was difficult.
Yeah.
It was difficult. And I remember some of the conversations back then where linked to the maternity, dads cannot be in, only certain circumstances, there were some problems. But I think it was important for the couple to be there. But I am grateful because maternity has been in the news recently, a lot of improvement needed. If anything, I only have good things to say. But to the point you've raised, I now have a daughter. I also have a second kid. But I want them tomorrow, if they need the National Health Service, that the National Health Service is more responsive. We know early detection in cancer is key. We also know the probability perhaps of cancer is, or at least suspected cancer, is 1 in 3 or 1 in 4 according to the latest stats. So I really want my kids to be able to use an NHS that is a 24/7 service, 365 days a year, and whatever happens to them, they're there to support. That's tomorrow. Today, what I want to make sure is that if I need the NHS, and coming back to something we discussed earlier on, how can the NHS support me if I need the NHS today? How can I continue to work in a way that I see myself in that hospital bed, I see myself in that community setting, and what would I like to happen to me as a patient? That's probably the way I work and the way I will continue to work, and that's the way it brought me to nursing first and foremost. Is the patient, is the safety, but now with the opportunity to do things at scale and more impactful for the population we serve.
fantastic. And what would you say to nurses, to operational staff, to frontline staff who are interested in making that switch? What advice would you give them? What advice would you give a young Bruno?
Those individuals, be it in the nursing, be it in allied health professionals, or even with the medical workforce, is about believing in what you do. Is being done for a reason, and for me, that reason has always been the delivery of patient care. And I think the advice is to surround yourselves from people that are capable of understanding what you're trying to achieve, in a way allow you the opportunity to grow into some of these projects. I remember going back to the days of nursing, and I don't know, Fayaz, if you fully understand what does it mean being a nurse, bedside nurse. I remember coming to shift 7:30 in the morning, getting the handover at 8 o'clock. You start delivering care to the patients, so the daily routines, washing patients, medication. If you are in a surgical environment, you do your dressings, then you participate in the ward rounds, then you do your records, then you look into skin care, mobilization. So actually the day is full of activities. And that ability to understand probably where the challenges are that prevent you from spending time with patients, quite often are the opportunities that you tend to take forward and actually drive the change within the tools.
Fab. And that's a lovely segue into the next segment, which is the breakthrough itself. What I'm interested in is understanding the program, the project that you've led or worked on that's used the latest thinking, that's used the latest technology, digital innovation, or maybe not, to create real meaningful change for patients? Can you talk about some of those?
We've been able to really empower frontline users. So anything you do at the moment in the space I operate is about a combination of subject matter experts, clinicians as a background, that join forces with group of engineers that actually are capable of developing solutions designed by the users. And those solutions are then piloted in real-time scenarios following all the governance frameworks that we have available to us. And that scalability then becomes an organizational change that sits behind motoring this program of works around digital innovation.
And you've talked about it at program level. For those of us who don't know the specific product or innovation that you're talking about, can you be quite specific? What's the specific thing that is innovative about it, what it does, and the impact that it's had to date?
So there's a few projects there, a few programs. So we talk about when we talk about digital ecosystems, we talk about your electronic patient records, your radiology records, pathology records, patient questionnaires, text messages. All of these things sit in silo, but are there as a supporting tools to enable you to deliver that kind of patient care. The specific projects we looked at was something called an inpatient application within the newly commissioned data platform from the NHS, our ability to look into the wait list and very easily book patients into theatres. As an example, we know that if we follow that end-to-end workflow, utilization goes up by about 6%. Now, it might not come across as a significant improvement, but we're talking about thousands of patients. If this was to be adopted at the national level, that traditionally would have lost the ability or the opportunity to be slotted into gaps within that theatre schedule and actually maximize something that is paid for, and not only support that reduction of the wait lists, but actually make the most of the resources that are available to us. Another application is when you actually give an opportunity to the nurses, as I have had an opportunity to do so, following a little bit what people gave me the opportunity to do. And these individuals, just picking up that piece of software, they looked into a problem where patients were having their outpatient appointments cancelled, but transport that sits on a different system was not cancelled, and the ambulance was knocking on their doors. By now connecting the data points, they are able to save a significant amount of money over the year by negating those costs.
Got you. So because the transport team didn't know the patient had cancelled, they'd be waiting there, waiting for the transport.
You'll be surprised
on the clock
of the unknowns just because the data sits in silo. And once you start surfacing this information, once you start addressing the interoperability, and you create that kind of single data layer that you can leverage your applications, it becomes more transparent, easy to action, where before it's been quite difficult. We spend far too much time discussing the numbers and why the numbers don't match in reporting A, reporting B, or reporting C, rather than discussing the actual problem that is causing the numbers to be the way they are.
Absolutely. Talk to me from a patient's perspective. What does that look like? So how am I feeling? How am I interacting with the system? Where are my benefits? How am I engaging with data and technology and AI in order to make my care better?
I've been a patient myself, so I'm going to tell you a story. Yeah. In 2008, I was diagnosed with cancer. I've been lucky enough that early days I had surgical intervention, and straight after my surgical intervention, I was put on a 5-year cancer pathway. And It was quite intense for me. If you're not familiar with the cancer pathway, the first year I had blood tests every month, X-rays every other month, and then in between some CT scans, and that gradually decreases over time. I wish back then I could have had an application that will enable me to share how I was feeling, manage my appointments online, organize the bloods in a way that suited me, and actually have someone that could interact, be it through an AI agent, be it with actually an healthcare professional, by connecting. And I think that's, from a patient lens at the moment, what I think we need to equip some of these applications. So the patients find access to care easier. If you look into the satisfaction at the moment of healthcare from the population, is quite low. And I think it's quite low because quite often it does relate to access to the information. Once you've got access, I think everyone has only positives to say about the doctor they've seen, the nurse that is looking after. But there is that access, that communication, that I think there's a huge opportunity with this technology to significantly improve. And it doesn't need to be in English. It can be in your preferred language, because technology is there, and that's another thing that we need to address and equip what is a very diverse population in England.
One of the key aims of the NHS isn't just to be the biggest employer, but the best employer. And a lot of the worry people have around AI in particular is that it's going to come for our jobs. We're going to be unemployed. It's going to be difficult for us personally. What is your view on that? What's your take on that?
Look, it's a difficult subject at the moment. It comes back. I don't know what the future holds, but I think the future is very exciting. I think what keeps me going every day now is this passion for utilizing the technical capability that exists to get to see patients faster, the ability for us to reduce the costs it takes to deliver care, but accept that there are roles that we currently have doing more of the manual transaction of patient activities that will not exist in the future. And by not existing in the future, it not necessarily means that they are going to replace me. It means that I also have an opportunity to upskill. Can I tell a story? Because
Please, go ahead.
So we talked about the opportunity that I've had. 2 years ago, I spotted a nurse working in a clinical area. You asked about that mini Bruno, but he was operating, I could see him operating the same way I saw myself, very keen on productivity, very keen on efficiency. There was an opportunity, and he applied for a job and interviewed it very well. And we gave him an opportunity. Being a nurse, I know from that process that no way you would get anywhere near coding and developing the software to fulfill some of the use cases. I now know that not only is utilizing the tools and driving some of the change, it's actually coding. So we've been able to demonstrate that not necessarily need to be where you were 2 or 3 years ago, and now is responsible for change management, is responsible for driving some of the product development, and is actually spending time coding. And I do think there's an opportunity, using coding as an example, to upskill a workforce, because there's also going to be new jobs that are going to be needed to support the challenge and a number of clinical and non-clinical pathways we have to try and continue to learn, continue to improve. So I don't think there's going to be a scenario in the near future where we potentially have doctors being replaced by robots, if that's what perception is about AI.
You and I have been fortunate that we've actually travelled together internationally to see healthcare systems all over the world. What have you found inspiring about those systems and the way different cultures, different countries, different continents are approaching the challenge that everyone is facing with improving patient care in challenging times?
So look, the reality is that everyone is facing the same problems. That's for sure. From colleagues in Australia that I've spoken about cancer management, to colleagues in Brazil about the coordination of activities around that ED. And you will be surprised, we're talking about Brazil, where I have been looking at some of the models. I don't know if you know this, but Amazon, there are
The Amazon rainforest or the
Amazon rainforest.
Okay.
There are populations within the Amazonia, as it said, that have never seen a doctor. And their ability to take digital involved low orbital satellites to provide 5G connection and pods that will automatically. So I have seen it first time, how then the population reacts to seeing a doctor for the first time, sticking in a pod. So it's fascinating what happens.
When you say in a pod, what do you mean? A doctor's kind of beamed in?
Not yet. Yeah, we'll get there. The Star Trek type beamed in. A pod where you have a camera, a TV, microphone, but it's a pod that the only thing they need is a generator run on diesel that needs power in the middle of nowhere, but has a satellite capture and actually a 5G signal using actually the Starlink connectivity. But that to say, everyone has problems and everyone comes up with these initiatives. So actually, one of the things that I then found fascinating is how users respond to it, and underlying on that response, there are some that have done better than other. The interoperability and integration of data is key to unlock some of these. And looking to some of the recent examples, that ability to then drive the innovation, empower local SMEs, but empower in a way that you are just not developing something that is seen in silo, but something that looks at the same numbers, looks at the same clinical information, but can easily scale to others if they resonate with the problem. That's, I think, something that I've taken on board.
And you're saying that is a global thing, so not just in Brazil. That's people who've got connectivity right. They've been successful.
The connectivity right has driven the success, 100%.
And do you know what? I find a lot of people don't quite understand what that means. So we talk about integrated care systems, we talk about data interoperability. People don't quite understand the concept and therefore can't quite visualize the outcome. What's your take on that? What does it mean to be connected? And what is the tangible thing, the outcome that it enables?
Okay, so I'm going to try and use an analogy just because you put me on the spot.
Love your stories.
I love my stories, but actually probably not so much of a fancy story. Let's search for a flight. You can either go airline by airline today, British Airways, EasyJet, Ryanair, Or you can actually go to an application on your phone that brings all the airlines, and the only thing you do, you put dates and you select a couple of filters, and that tool gives you multiple airlines to choose from. That can only be possible because that application layer is integrating data from all the different airlines. You don't need to have a one airline. You can have 900 airlines at the moment, but that application layer brings all the information into one place. So you as a user starts integrating with that common data model, and only when you need to go and perhaps do the booking, you go directly to that
Got you.
airline.
So you've got to your solution quicker.
You got your
It's
solution.
cheaper.
You got to get your solution quicker. You have consistency in how the data is being displayed. When you select that you want to fly in the afternoon and you want to arrive in the morning, all the filters are applied to the 900 airlines. So that's probably the closest I can get to right now.
Okay.
There's probably going to be others. But that, if I was then to translate into what we do at the moment, we have all these systems a little bit in silo. The interoperability and sharing of information is still fragmented, and that is preventing us from having that kind of visibility at the system level of what's happening.
Interesting. So just to move on to a different part of this interview called rapid fire. So I'm going to ask you to use one word or a very small sentence to answer some of these questions. So firstly, one word to describe your career to date.
Passion.
Nice. One thing the NHS gets right that we don't celebrate enough.
Success. And look, you asked for short,
No,
so I'm
I
going to
know.
try and keep short. But the reality is, if you look at scale, the NHS is about 1 million people a day. We get it right most of the times. But even if we were to get it right 99% of the times, which is a extraordinary metric, there's still 10,000 that will get it wrong. That kind of 1%. I think I've got my maths right.
That's right.
So there's still 10,000 people. We can do something about it. But I think we need to celebrate more what we do. Celebrate with our workforce, but acknowledge that we have to do better. But that's just the drive. I know you want to move on some other things, but I go back to I'm a passionate on Formula One, by the way, and back in 2017, 2016, I wrote to a Formula One team, Mercedes F1, and I wrote about wanting to understand more how the team operates, how they were able to translate the vast data that they gathered and make split-second decisions, and quite often they were getting it right. So I got a response, and interesting, their response was, well, normally people contact us to give charity, money. You're asking us for knowledge. How can we decline? So I was very lucky to have had some of those doors open. And the conversations with, again, I don't know if people know, Toto Wolf, the CEO and team principal, his team was about the marginal gains. And something that is well documented in some books. But everything counts towards delivering. And some of the concepts that we've developed around the digital actually originate from some of those conversations, which I will be forever grateful about that. But there is something there that they don't win every day, every weekend. but actually there's a celebration that needs to take place. There is the ability to understand at the local level what's happening, so everyone can contribute, not because you are a ward nurse or a CEO. There's a voice to be listened. And actually, if there's an opportunity to improve, I think it's important we take that on board, we listen, and we execute.
Do you think we do that enough? I found that myself. If you ever ask anyone from any industry, can you help us with healthcare? Everyone is so forthcoming with ideas, time, even money. Do you think we do that enough by reaching out to other parts of industry, other sectors?
So I do that. Don't take me wrong, it's great to see what's happening in healthcare, but I like to see what other industry is doing, whether it's Formula One, whether it's logistics, big corporations moving items across the globe, is not very dissimilar from us needing to have theatre kit in the same space. The aviation with inspection on quality elements of the plane before they take off is not very dissimilar to the quality assessments we do, be it on the patient or the checks. So I do think we can do more, and perhaps there's willingness from these companies to give something back to us in terms of that knowledge, and we need to harvest.
Fab. And that's a fantastic segue to my final question. If there was one piece of advice that you were giving to somebody up and coming within the NHS, maybe on the graduate program, maybe they've just become a junior doctor, maybe they're in HR or tech, what would you give them?
Focus on the patient. Put yourself in that bed, whether you are a manager, whether you are a clinician, whether you are in the IT department. Try to put yourself in that bed and perform and do activities as they were having an impact on yourself.
Thank you. Thank you, Bruno. Very wise. Appreciate your time. That's it for this episode of Behind the Breakthrough. Thank you for listening and being part of this conversation. If you liked what you heard, give us a follow, share it with someone curious, and stick around. The next one might just surprise you. Thank you.